Where?
Hello, welcome to our Friday webinar. We're on with Dr. Tom Tully for an episode of Ask the Vet.
Greetings. Well,
Welcome,
how
Dr.
you doing,
Tully.
Laura? You doing well?
Doing good. So while I wait for people to log in, so last Friday when I was on with, uh, I think who were we on boy, my mind's just going crazy. I heard, I thought I had like a big fly in my, background. I kept hearing this buzzing sound, and then I'm like, oh, it's a bee, right? And so what I didn't realize is it wasn't just one bee. When I got done with the webinar, I had like 15 bees. I had like a little hive that kind of came in. And so a few of them were like in my bird's cage. And it makes me ask you this question is like, do you ever treat birds that have been stung by bees? Is it possible to get through those feathers? Because it was like the bees were now like in my bird's cage. And I had to gently try to find ways to get them out of the house safely. So.
Well, I don't think I've ever had any any uh bee any birds that have come in with bee sting. Although that's possible, and I'm sure that somebody's treated one for wasp or a bee or whatever sting, and it would be treated. Always say medicine is medicine, and so it would be treated similar to what we would be treated with to
Mm.
reduce the inflammation that would be associated with the toxin of the sting on that. But that would be highly unusual unless undoubtedly the queen liked you and came into and led all of her troopers into
Yeah, yeah.
house. Uh, but uh, but no, it would be somewhat unusual in most cases. But you could have like wasp nest in a aviary situation, but not usually in a uh,
Indoor.
in kind of a house cage or something that like that. Um, but outside that could be a situation, and then also it would be something that would be hard to um, say that you wouldn't actually see it. So you would see the swelling, the redness
Mm.
that would be associated with it. I don't think that we'd be looking at anything life-threatening, but painful, just like it would with us. We get more problems here. We've had birds that have been become anemic. Mosquitoes, of course, love birds, and they could actually cause severe irritation around the featherless areas of the bird, around the face, the legs,
Mm.
on that. And they also can transmit avian pox to other birds that we don't see much of that in parrots, but we do in just about ducks,
Uh,
chickens, things like that. Anybody have backyard birds, and you can vaccinate for that. But we also get these little really black flies, and about this time of year, but they're kind of all over the world, but they specifically target birds, and they're very aggressive feeders. They feed in the day, and these black flies, they're also called buffalo gnats, and so it's not just within the Gulf Coast area, but it can be in kind of the eastern and kind of the south central region, and people up in the Midwest are more familiar with probably the black flies that come out. But these particularly like birds that we have here, and they can actually kill a bird because of the severity of the toxin that they have. They're small, but they're, like I said, very aggressive feeders, and they won't stop at anything to get a meal. So
oh,
I even talked to a veterinarian in Poland, and they had some problems with something similar in their um, at their zoo in Poland. Yeah.
Oh, wow.
Yeah,
Okay.
and so he mentioned to me that they used vanilla, kind of a not kind of an extract, but uh, real vanilla, kind of diluted, and they would spray on the birds, kind of a natural deterrent, and that seemed to help. But wind, if you have a fan, something like that, that really helps tremendously. And also, if you can protect the birds if they're outside with a small screen, because these are small, that would be, have them, and it's only about a 2 to 3 week period where these come out, especially in the, like I said, on really the east area. They need a lot of water to for their life cycle and things like that. So not necessarily bees or wasps, but there are a number of insects that can that we've seen problems with on that. Yeah. So good.
Okay.
Yeah.
Yeah. So if you're just joining us, we're gonna let's see. Oh, let us know where you're logging in from. We'd like to see in the chat. But use the Q&A button for your questions, so we can capture that. So let us know in the chat where you're coming from to join us, and then use your the Q&A button for the question. We have Lisa Bono working the background today for us in place of Brenda and Michiko. So she'll be working the behind the scenes here. Okay, so are you ready? So we do have a question for you about an 11-year-old female budgie has several issues. One is liver issues. She's on milk thistle and with lactulose and urosodial for liver support. Because of her liver issues, she's showing some petechiae around her eyes. But she's been put on vitamin K in hopes of resolving that. Would you recommend anything additional or different treatment? Sorry if I killed words there.
Yeah, that's a good question. Well, of course, and I want to thank all of our webinar the people that are on and are attending and participating in the webinar, and as we all learn together. And thank you for your questions. Really appreciate that. And like I said, we all learn, and that's the beauty of it. And
Yes.
and also, as we think about this question, on the reading, and Laura, it's petechia, I believe, is the correct pronunciation of that, and so people may wonder what the world petechia is, and again, that's why you're here, and that is small, like bruising. It's like little bruises. It's small bruises. You have petechiation, and ecchymotic is a little bit larger bruising, and so that's what's around the eyes. And of course, is it only around the eyes? Because that is what you can see, right? You can see the featherless area around the eyes. So it may be involving more of the body. The one thing that you have with liver is that you have there's many things that could cause liver damage. I think everybody is familiar with that. I mean, in anything, the liver is a very forgiving organ, thank goodness. As you know, if it 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 takes a lot to have severe damage to the liver. It recovers quickly as a detoxifying organ in the body, and so when you have liver issues, you have to think about what's causing those liver issues. Okay, what is the magnitude of those liver issues? And this is one of the challenges we have with budgie, right? we have, although we've had some 50-gram budgies and 60-gram budgies, like, I mean, like, whoa, where did this come from? Most of the budgies are 30 to 40 grams. So there's limited diagnostic tools that you can use to try to determine what the, I guess, the overall condition of the liver is, and what the and what's causing any problems. So that's the one question that I have, is that if you have liver disease, I guess, damage, liver disease, that one of the consequences, if it's severe enough, is the inability to clot. Okay, your blood, you have an inability to clot. That's why if you have a polyoma virus, which is a virus that affects birds, it attacks the liver. And one of the signs of polyoma virus infection in young parrots, non-budgie parrots, is that they get bruising. Okay, you get bruises because the blood can't clot, and so that's one thing that affects the liver health. And so that's one of the things that can cause it. So an infectious disease can cause it. There's also toxins that can cause it. You can have cancer that causes the liver. You have problems, and in toucans and minor birds in particular, you can have hemochromatosis or iron storage disease, that iron accumulates in the liver. It also happens in humans. Humans have iron storage disease. So when you're looking at the budgie, you have liver, liver health issues. You can have a bacterial infection. So what that means, and where I'm going with this, is that if you know what's causing the liver to have a problem, that's when you treat that or reduce the intake. If you have hemochromatosis, you may have to have phlebotomies. Has been a recommended treatment for birds, and then also in humans to reduce the red blood cell level in the body. But and if you have a bacterial infection, treat the bacterial infection. If it's a toxin, you can treat and reduce the toxin level in the bird. And that's going to be your best way to handle a liver issue. Because when you look at what you can do to treat liver issues, and you say, well, is this a good treatment plan? Because the bird has liver issues. And so you have, let's see, what was the things that was mentioned? They had milk thistle.
With lactulose
and lactulose. So let's just start with lactulose. And so lactulose is to kind of reduce the liver has, if it is damaged, it's going to have a reduced ability to remove toxins from the body. Like if you are consuming alcohol, then it would be difficult for you to recover from being intoxicated, because the liver, it doesn't have an ability to reduce the toxins within the body, and so the lactulose helps with that, and so you have the lactulose, and then you have milk thistle. Celamarin is a kind of an active ingredient in that, and it's a protectant. So it protects the liver. It doesn't really treat So if you have continued something continue attacking the liver, it will help protect the cells from being adversely affected by whatever's attacking the liver. It doesn't make the liver better in a sense. It just protects it from getting worse. Okay, in certain conditions, and then and so pretty much that's what we can do with what we have available to treat liver issues. Reduce the toxin with the lactulose and the other ingredients to help protect the liver from increased damage or quicker damage or what have you in certain circumstances. It's always good if you can try to, and so the treatment is about what you can do if you determine that there's liver problems. But it's always good to try to know, kind of have an idea if it is what's causing it. And but like I said, it's difficult with a budgie because they're so small. It's not like you can go in and, I mean, you can get a liver biopsy on a little budgie, but of course a major that's a major surgery for a budgie that small. I would consider it. I would tell an owner if I was doing that, because it would be difficult for you to put a endoscope in there and get a biopsy. So you'd have to do a little keyhole incision, just caudal to the keel, just behind the keel, and get a little get a biopsy on that. So it's kind of a open coalomic surgery on that, but that would kind of give the pathologist an idea of what may be causing that liver. And then also you get a chance to see the liver to see if there's anything there, if it's enlarged, or if it's has different coloration to it, or if there is some type of a different growth that may be associated with a tumor or something like that. If it's extremely enlarged, you can feel it, because sometimes budgies are not. It isn't uncommon for budgies to have liver tumors, and you can actually feel the liver, the enlarged liver, just behind the keel. But this may not be the case, but that's kind of the key, because the treatment is about all you can do without knowing what it is. And even if you knew what it is, that may be the only treatment. We have one of the things that we have is integrative medicine here at LSU, and there's other places that have that. And the integrative medicine, as I've mentioned before, is the integration of Eastern and Western medicine. And so we do have with our integrative medicine service, if we have a patient that has liver issues that we need to treat, similar to maybe your budgie, they have an herbal medicine that's called Liver Happy. I can't think of anything better. I can't think of a better name than Liver Happy. I want a happy liver. And so we'll do that also and prescribe that. But that's again an herbal blend that they prescribe for liver ailments. But otherwise, that's a difficult situation, because you'd like to try to treat something specifically, and you're kind of it's a difficult situation with such a small bird to find out what it actually is.
Okay. Okay. A question about, is there an appropriate weight range for a 2-year-old male double yellowhead Amazon, or is it best determined by an avian vet feeling the keel bone?
That's a good question, and I think that the answer is within the question, because as I've mentioned before, that's like, is there an ideal weight for a human? Okay, and so somebody that I've said is 5'6", the ideal weight for somebody that's 5'6" is going to be a lot different than somebody that's 6'5". Okay, and so that's the same way with birds. And so you're always looking at body condition, and that's the same way with pretty much humans also, is that you look at body condition for the body size of the bird. And so you'll have, I've seen, I think just offhand, having a little bit more variation in size of, say, blue and gold macaws than this at double yellowhead Amazon, you know,
Yeah.
or a yellow nape Amazon or a yellow fronted Amazon, ochrocephalus species. If you have any of the, I've seen, like, what a good weight on a blue and gold would be 800 grams, and I've seen close to 1,000 grams on a blue and gold macaw that is appropriate. And so it's the same way with the double yellowhead. And I may add that you do not need an avian vet to tell you if it's in good body condition or not. And so what are you saying on that? So, you're going like, well, what you need to do is feel the keel, right? And so, and so I'm going to say, just for ease, because we have a situation in medicine where everybody wants to put their stamp on medicine, right? I'm a doctor, I want to be important, so I'm going to make this up. So we started to have body condition scores of 1 to 5. Okay, so we have body condition scores that I have to look. So 1, it's backwards, but there you go. And so then somebody said, well, it's just not enough, so you need body condition scores of 1 to 9. Well, I argue that 1 to 9 isn't enough. Go to 1 to 100. Okay, 1 to 5 is fine. You don't need 1 to 9. But what you're looking at is, if you're looking at the keel, you're looking at a situation where you're having the keel bone and you're feeling the breast muscle. Okay, think of a Thanksgiving turkey. Okay, and you're looking at the Thanksgiving turkey. Okay, and so you're in a Thanksgiving turkey would be very conditioned. Okay, you would want one. You'd want one conditioned. You wouldn't want one under conditioned. I wouldn't think. Wouldn't feed many people. And so you're looking at it. And so when you're feeling your birds, and I would say that what you're doing is you're feeling the birds. And so it's like, if you cut the bird right in the center. And so if you have a body condition score of 1, you can almost, it feels like a razor blade. Okay, you don't have any muscle, very much muscle at all. A body condition score 2 you could feel the muscle, but it's very thin. A perfect body condition score right here is where It's kind of coming down over the edges. You get 4 is a little bit more. It's rounded, rotund on this. And then a 5 is where the keel is actually indented, okay? Where like a Thanksgiving turkey, okay? You see that?
Yeah. Yeah.
Okay. So you don't need an avian vet to do this. And you should know how to do this because you need to know how conditioned your birds are. And you should always work toward a 3. Okay. I'm not going to give you anything off to have a 4. Okay. But you know, if you work in this area, that's what you're looking at. And so it's not about the bird perfect weight. I mean the species. It's about that individual bird. And then you can do it as well as an avian vet can do it. And you should, because you should be able to feel it, because the feathers will make a 1 look like a 3. Okay.
Mm.
And you just can't, you know, unless you feel that, you will not know if it is or not. Okay. So there you go.
Would you have to towel the bird to do that properly, or?
Well, I mean, I mean,
I mean, can you
I
just?
wouldn't have to towel my Senegal, you know, but some birds you would have to towel, and
Yeah.
you know, I mean, it's dependent upon the bird. You know, you could just feel it, you know, rub the bird like, woo, go ahead, you know, or like, I don't want anything to do with this. I'm going to bite your finger, you know. So it's just, you know, and that's dependent upon that. But it would be good if you could do that from time to time just to get an idea of it's done in a split second, you know. But that's what we look for. Well,
Mm.
what I look for in a bird when I'm assessing its overall general health, and it's like, and like I said, you know, and I've said this before, Laura, you know, you hear me, oh, birds are prey species. They don't show clinical signs, you know, of illness. And I say that's a bunch of hooey, you know. I say birds do show abnormal behavior when or signs of if they're ill. You just don't notice it if you're not aware of what to look for, or you're not observant of the bird. People are busy. People are busy. They're going. They may have 50 birds. They don't see them all the time. They don't know what's going on, or they're, you know, they have children, or they work and feed it, and you know, and they just don't notice it until the bird's on the bottom of the cage. Oh, it just happened. Well,
Yeah.
if you feel the bird, you know that it didn't just happen. And you say, well, I didn't see anything. Well, it's just like you have to just kind of be observant, because birds will stop eating. They will not be as active. They're not going to perch where they normally perch. There's going to be behavior changes. And I can tell you, very observant owners, they'll bring a bird in and it's not doing well. Or there's others that say, Doc, you know, it's 99%. It's just not 100. Can you believe that? 99%, you know, and birds don't show signs. Observant people, they do show signs, you know, and it's not the easiest thing to do, but it's not because they're prey species that they don't show signs. You know, I'm tough, you know. No, they get sick as just as anything as we do, but you look for it, and that's why if somebody says, well, it just happened, you know, just noticed it, and then we feel the keel, and it's
Yeah.
thin as a, you know, very, very thin. So it has been occurring for a period of time. It kind of gives us an idea on how long something has been wrong with the bird too. It helps us kind of determine that what we call the chronicity or length of time. Yeah.
Okay.
Yeah.
Well said. We have a question about, is it normal for a cockatiel to twitch their head, especially when they're excited, otherwise acting normal? And they were negative for chlamydia testing and crop testing. So got a cockatiel that's twitching its head, especially when it's excited.
Yeah, I mean, it could be, the one thing that if there is some type of abnormal behavior, and obviously it's been examined, and as far as physical exam on the bird, and so that's what I would say is that if there's any abnormal behavior or something that is you have any questions like that as it relates to the bird, that to get it checked out, get it checked out, and just to make sure. That's what always helps us, is that if we're ahead of the curve, it's a lot better for to be than being behind the curve and treating, and that's where we have the most success. And so when there is a kind of a behavior issue that's abnormal, that the owner is concerned about, just may not be aware, that well, let's just get it checked out. And like I said, it's you get a physical exam, you look at the body condition, you look and see if there's any what we would call overt clinical signs of disease. As I've said, animals don't get symptoms; they have clinical signs of disease, and check the bird out, get a, and that's external. And like I said, that's all external. I can look at it, it looks good. There's no clinical signs of disease, and then that's where a blood test, where we get the CBC, look and see if the red blood cells, if it's anemic or not, if it has inflammation that may be associated with the abnormal behavior. We can look in, and the CBC is something. And we can also do a chemistry panel, and that looks at the calcium, the phosphorus, the glucose levels, some of the enzymes, muscle enzymes, liver, that maybe can combine with muscle. And so there's a lot that can be. So you're looking, just like if you had an issue, you would go, and I'm sure the physician would say, we need to get blood work. But that's, you said, well, we can't determine it just by the way your symptoms. And so we need the same thing. And looking on the inside, if the inside matches with the outside, meaning nothing on the outside, everything's normal, or on the inside, then it would we'd look at and say that there's the possibility is that and well, of course, we go through the history, because sometimes you can have neurologic signs associated with toxin ingestion, heavy metal or something, and we would run those tests, the appropriate test. If we felt like that, any kind of imaging, X-ray would be helpful. Also, parasite exam, that would be also included. If everything's negative or normal on the testing, or if you have your testing and exam, then it would be behavior. And when I'm looking at, I'm talking about the birds rarely have ear issues, but they can have ear problems, and this would be something that that would cause the bird to twitch its head. But if if the ears looked fine, then and everything else is negative or normal, as I mentioned, then it would be just kind of an idiosyncratic behavior issue. The one thing that I try to stay away from is the easy way out, because you can get in trouble doing that and just go like, it's just behavior, just deal with it, you know, and that's everything's fine, just looking at the bird or what have you, and saying, oh, it looks good, and nothing there, and you don't do some of the additional testing to see what's on the inside, or any of some of the additional tests I mentioned that may be there, then what happens is that the next thing you know, it isn't just behavior because you didn't look closer in there, and it's very, you always want, you have that pulling at you like, oh, it's just behavior, that's just like uh, feather destructive behavior, uh, and I can tell you when birds pull their feathers out, that's feather picking. It's still feather picking in my book, you know, because I've seen feather destructive behavior, and that's not feather picking. That's just destroying feathers. And I've seen destroyed feathers on birds, but I've also seen birds that have been plucked like Thanksgiving turkeys, and that's feather picking to me. It's just semantics, but I'm just going with what I see. Calling
Gotcha. Yeah.
what I see. And it's not destructive. It's gone.
It's gone. Oh, wow. Like a freezer chicken.
Yeah. But anyway, hopefully that helps a little bit. But yeah, in the end, if and I don't, it's good that the chlamydia test is negative on that, and that and that's always backed up with a CBC. It's always nice to see that. But the panel, and then there was something else that it chlamydia test and something else,
Crop testing.
crop testing, and I guess um, that would be like a culture. That's what I'm just that could be a culture, or they could have taken a swab and did a just cytology, just looking at any of the organisms or cells within the crop itself. Yeah.
Okay. All right.
Yeah.
We have a question about two English budgies that have had issues with intermittent coughing, especially after chewing on certain toys like cardboard or egg cartons. The vet suspects this is due to the English budgie's genetics, and that they may have smaller or differently formed an airway than their wild type counterparts. Have you ever seen this, and are there any suggestions to mitigate the episodes? So we're talking about English budgies. The
Yeah.
vet's saying that they might have slightly different budgie genetics.
Yeah. So it's interesting that there's two of them, right?
Yeah.
There's two, and they both do the same thing, from what I'm to understand, based on the question.
Intermittent coughing. Yeah.
Intermittent coughing. And I'm just trying to visualize a budgie cough.
Yeah. Yeah. Same. Yeah.
I don't think it's loud, just like a budgie voice. But I mean, this is good, and I would have to say that this is when you have something like this. I haven't had any I've seen a lot of English budgies, but never have had this problem. But you have two doing the same thing, and the way that I would look at it, I would say if something is that I would there's two things. If you're that to try to see if there's a problem involved. This is one of those things like, well, it could be some kind of a genetic issue, but I haven't really heard of this, and I've taught and I've been in really and have had a number of owners that have raised English budgies and a big budgie and raising budgies and they haven't had this saying, well, they have this issue. But the interesting thing is that it's noted only kind of more so when they chewing cardboard, right?
Yeah.
Otherwise I would say if they're normal, I don't know why the cardboard or and then they chewing paper, why that would be something that would kind of initiate this kind of condition. I'm trying to think dust or whatever, and I don't know that. The only thing sometimes there's binders in cardboard to keep it together. There's chemical agents that are used that are in manufacturing for the paper and the formation of cardboard. Maybe the cardboard is causing some irritation within the respiratory system that both of them are experiencing, causing them to have these, like I said, I just this kind of respiratory response is what I would call it. I don't kind of coughing like behavior if it was a budgie. I'm kind of putting it in that situation. So that's what if you want it, so if they're acting well otherwise, then I would kind of refrain from giving them the cardboard. That would be my thoughts on that. If otherwise they're well, I mean, you're not seeing anything. They're good condition. They're eating and acting and behaving normally. Otherwise, then I would just refrain. There's a lot of other different things that you can provide for interactive activity for the birds. So I would refrain from that. I would try that first, and if it still continues, then you can look and see where you can do some diagnostic testing to see if there's any inflammation. You can even do radiographs on the birds to look in the lungs and the respiratory system. You could even do that, but the if there's inflammation or what have you, then there's other things that could be doing it. But it's very observant that you've noticed it's only in cardboard that they're doing this, and so that's the one thing that you can do is just take that out of their environment, and then try give them some other different activity items in there and in their environment that they're not doing. I have two budgies, and although they'll tear up paper or what have you, and I have some different little sisal balls and different toys and things in there that they can interact with. But good question, and that's something that other people can consider if you do see some behavior that is happening when you have only one, where it's associated with one thing. Well, remove that from the environment and see if that's resolved. And then, because there's always usually always other options. That's usually and always in the same sentence.
Yeah.
But anyway, yeah.
Okay.
Very good, but both of the birds are doing it, so you know, that's where it starts.
Okay. A question. It's a two-part one, so bear with me.
Okay. Any big words in there?
I know, and let's see. Let's dive into this. Cin- the citizen presents with the hard and stiff yellow foot pads, focal hyperkeratosis due to vitamin A deficiency. The diet is corrected for now for several months, and overall improvement is seen, but the foot pads remain the same. So the question is, how long would you expect for this to appear normally again? And two, is there any recommend actions to assist in this, such as manual removal of any keratolytic agents such as salicylic acid, lactic acid, etc., that you would recommend. Olive oil appears to also be keratolytic in nature, but there are also prescription options. Is there anything other than olive oil that you would recommend or can recommend?
Uh, yeah. So we have um, hyperkeratosis, which is thickening of the skin on the feet,
Yep.
and has been attributed to vitamin A deficiency. Now, that's I would say, yeah, vitamin A can definitely be involved in abnormal skin development and among other things, the outer skin, um, and also the lining of the respiratory system, eye. And so it's a very important vitamin. And so it's good that, and so it appears that you've resolved that issue in either supplementation or diet. So that's been involved, and and I say that in the sense that you still have thickened skin, right, on the feet. And what is this? What kind of bird is this?
They don't say. Maybe we can get more clarity on that. But yeah, citizen. So any
Yeah,
parrot.
yeah. And so my question is that usually, if you have, if you resolve the issue, then you'll have the healing occur, and that it's not going to continue, and that this will kind of resolve uh, pretty much on its own over a period of time. It's not going to occur overnight naturally, but it will resolve over time. So it's kind of that's one thought, like, why is it still as bad as it is over this period of time with that resolve? And so you want to make sure that, yes, it was vitamin A that was or a nutritional deficiency, and that if it was a nutritional deficiency, that whatever the bird is being, you know, um, fed or supplemented with is addressing that, or has addressed that, um, and that it's not something else.
Hmm.
Um, and so, and when you're looking at a keratolytic agent, okay, is what was kind of mentioning, is to try to suppleness, trying to smooth and get, where your hands are all nice and soft, you don't have calluses on there and things like that. Um, uh, for the most part, what you mentioned is agents that I think you mentioned hyaluronic acid, and you mentioned olive oil or an
Mhm.
oil, and like even mineral oil or something of that nature.
Olive oil. Yeah.
Yeah, you mentioned
Oh,
olive.
and by the way, it's an Amazon, a yellow shoulder Amazon. Just got that.
Yeah, okay. And so what I would say is that a lot of what the keratolytic aspect is that it's not necessarily going to just uh, kind of remove that uh, that 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 thickened skin. What it does is it softens the hardness of that thickened skin. And so when you're rubbing it, then that softness of that thickened skin comes off really. And it doesn't and it sometimes depending on how thick it is and how dry it is, that it could come off in larger pieces, or almost imperceptible pieces of skin. But over time, you are getting that thickened, calloused tissue or skin off of there. And I wouldn't say, and so it's not necessarily what you use, it's using it and massaging that foot with a little towel or something like that, as you're putting it on. That is, as you're applying it, you're also debriding that thickened skin that is going to, as it softens, is going to separate from the underlying layers till the point where you get back to the foot. So it's really a foot massage is what you're doing. There you go. And I'm sure that the Amazon would appreciate that. But no, it's not anything mysterious. It's not anything difficult. Like I said, just makes, if you have it on a good diet now and you're supplementing, that's great. And then olive oil is fine, to use. But it's not the lytic agent. It's not like you're gonna put it on and peel it off, or are you gonna put it on and it's gonna fall off.
Mm.
It's the application and the massaging that uh, kind of debrides and separates that tissue, I mean, that thickened skin from the underlying layers. And as you soften it, the softened tissue and cells are going to come off until it gets to the harder ones. And so you work it down to the over time. It's going to be maybe weeks, months, what
Mm.
have you. But eventually, the little Amazon should have very soft, nice feet.
So follow. So if a bird presents like that, I mean, should a first step be to see an avian veterinarian to get it looked at before you try like some? Do you need to have a
Well, yeah,
diagnosis?
I mean, if you have it, and um, I can't think somebody bringing in a bird and saying, "Oh, the feet are thick and the and rough and the it's I don't, it's not usually something that somebody's going to bring. If you have the problem, then yeah, it should be seen, to try to, like I said, that's always the issue when you have something. And I can't really um, think of anything else when I have a case. When I have a case that comes in, it's like, what is causing it? What is
Mm.
causing the problem? Not how to treat it, but what's causing it so I can treat it properly. Because if you don't know what's causing it, the odds, go to Vegas, because that's the odds of picking the right treatment, right? It's like, unless you really have an idea of what's causing it. But if you don't know what's causing it, then what do I use? How do we resolve it? Like I said, you say, well, I think, this is what we should use, but it never gets better,
Mm,
So am I doing the right thing if it never gets better? Or is it something else that we need to treat it with? You know, you know what I'm saying?
yeah.
So the the real key is um, finding out what it is, you know, on that. That's the real key. And so I think on this, mm, that they determined that it was nutrition. That's been resolved, and now it's just getting the feet back. Now, if this doesn't work, then well, we thought that this was what it was, and the feet should it should improve. And like I said, it's not going to happen overnight, because the skin didn't get this thick overnight, you know.
Mm, yeah.
Yeah.
Okay. A question about a half moon conure that recently flew into a wrought iron table leg. So he hit his head, scraped some of his white skin off the left eye, and now, so since he's had this impact, he leans sideways on the left side for about 5 to 10 minutes daily, and doesn't know I pet his back. How long do these brain injuries take to heal? After it has the episodes about once to twice a day, the bird is back to being completely normal. Um, so what could be going on with this half moon conure who flew into a wrought iron table and leg?
Mhm. And so, well, um, sometimes just talking about brain injuries, whether it flew into that or flew into a ceiling fan or flew into a window or a sliding glass door, what have you, the wall. Yeah, it may take some time, and say, well, that's a great answer. It may take some time. What does that mean?
Yeah, what does
Right?
what
A
does that mean? Yeah.
day, a year, or 5 years, and all of the above are correct. It just depends on the severity of the brain injury. Um, the the positive note is that this doesn't appear to be a kind of a continual issue. It appears to be, where there's an episode. I don't know if it's a certain time of day, what have you. Could be at any time, but it goes through these neurologic episodes, and then they then it goes away. I mean, for the day, but
Mm,
it just seems like it's a daily routine almost. Um, and so that's a good thing, that it's just not a constant, like he's having seizures all the time. And I'm not calling this a seizure, it's just kind of an episode. Um, the other thing that you look at here is where it's head. Now for everybody that's on the the webinar, what was the statement about the head?
oh, that he hit his head and scraped some of the white skin off the left eye.
So
Uh,
scrape some of the white skin off the left eye.
yeah, it's a half moon conure.
Some of this, so it may be neurologic. Now again, it may be ophthalmo ophthalmologic. Well, let's just say eye
I
related.
thank you
Ophthalm-
for dumbing that out for me.
yeah,
Yeah.
yeah, yeah. And once I try and I can't, then I don't even Yeah, it's not going to come out, So ophthalmology, let's just put it that way. It could be the eye. And so it could be eye related. And so that's something that you may want to investigate to see if it's ocular in nature as opposed to neurologic, um, as far as a brain injury is concerned. So that is something else on that. But and then of course, you can even go further, and we have a neurologist here that kind of assesses neurologic issues in our patients, even birds, and that's something else that is a possibility. But I think I would look at have somebody examine the eye to see if there was any damage to the eye over and above what you could observe after the injury, because sometimes that can cause some problems.
Okay. Um, I guess let's say your bird, just as a final, flies into something. What would be like the immediate after? Like what should be your follow-up if your bird collided with anything in your home while flying, let's say?
Well, I mean, if it flies into
Like what
to
are you checking? Head, wing?
well,
It's
well, the one thing is that you're looking for recovery, right? You're looking for like, wow, it's just like, whoa, what was that? So the main thing you're looking for is recovery. Now, naturally, if the bird flies into something and it's just like laying there, that's an emergency situation. But if what you're looking at, it's going to be disoriented. There's no doubt about it. And so you'd want to, get it in, and if it depends on whatever is going to be the most comfortable for that bird. Because some birds, like, I don't want anybody touching me, I don't want anybody handling me, and it just flew out of the cage. And so you're not going to want to just kind of hold the bird, if it doesn't want to be held, normally, because that's not comforting. And so you'd want to put the bird in the most comfortable situation. If the bird wants to be attached to you, well, hug it, I mean, or just hold it, and so you want to have it regain, you're looking for it to regain kind of a cognitive abilities, awareness, what have you. And then just make sure that there's not a wing that's kind of cockeyed, or the leg or something like that, or the beak isn't broken and bleeding, which can be life-threatening if it's an eclectus, and
yeah.
it hits and the blood's coming out. That's like, they could die from that, and so you want to look and see if there's anything other than the bird just like, just trying disoriented. And if not, and it's just disoriented, just to get it to back, and it may take uh, you know uh, uh, you know uh, an hour or two to just regain and it may even be sooner. But that's kind of what you're looking at. Is there anything obviously bleeding, in not in the right position? Is the bird aware, at least trying to regain some ability? If that's the case, then just it should recover without much issue. If there's anything otherwise, or you have any questions, then take it in. Yeah.
Okay. Okay, and then sorry. I just because this might be a timely question. It's a little different topic, but I just because this might be timely. So someone asked they how far would you expect a cockatiel could fly, because they found a cockatiel, a bird, and they're trying to find its owner and rule out like unlikely people. So in your estimate, how far could that cockatiel have flown to land where they are? Like, do you know any idea? Anyone have an idea how far a cockatiel? I mean, they're not, on the ground like a dog. They're flying like a crow's flight, right? So they could be anywhere. What would you bet your best guess as far as the radius of a cockatiel flying in your?
No, I would say within 5 miles or less, it wouldn't fly, just like put a jet in its rear end and just take off to, you know, Hawaii. You know what I'm saying? I mean,
Yeah,
I
yeah,
think that it would be, and here I'm kind of anthropomorphizing. I'm a cockatiel, and I just escaped. Where am I going to go? And it's a great question. I love
yeah,
it because theoretically, a cockatiel could fly from here to wherever, right? But it'd have to get food. It would have to, maintain its energy level. It would have to escape predators. It has no clue that are predators that would like it. So I would say that it would probably be a recent escapee, and that it wouldn't have gone far. And so that's why I say 5 miles. That's probably stretching it by
yeah,
about three. you
yeah,
know,
yeah,
yeah, and so, but I guess if it's frightening, it just can go. But I think it would be, it wouldn't go probably more than a mile or two. But
yeah.
it could, but that's what, because of all of those different variables in there. But great question. Very good.
Yeah, I mean, it's amazing that the cockatiel was found. That's a great outcome
Oh
so
yeah.
far, right?
Oh
Yeah.
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 Very much so.
So
Yeah.
lucky that they found them. They happen to be on our
Yes.
webinar today,
Yeah.
right? So,
Yes. 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 So we're appreciative of those. Yeah.
all right, Dr. Tully, we went way over time, but we appreciate you answering all these questions, as
Well,
always.
we
So
just have such
thank
a
you.
good webinar attendees, and I'm just thankful for them and their questions. And it's always it's always great. It's always a great time. Yeah.
Absolutely. And I just real quick, giveaway. We're gonna do a giveaway winner today. Hopefully the apple flavored Nutriberries are now out. So for a limited time only until July, we're gonna have the apple Nutriberries. So yeah, it's like a great way to kick off summer, right?
Yes, it is.
So, Pam Skidmore, you're our giveaway winner. We're gonna send you some apple Nutriberries as well as another Lafeber product of your bird's choice. So we'll reach out to you for that. Yeah, and we'll be seeing you next month, June, with another great episode of Ask the Vet. And so, if we didn't get to your question today, we got through a lot of questions. We'll maybe circle back to it for the next episode, or we'll email you an
Yeah,
answer.
and I
One
don't
of
even
them.
know when the next one is, Laura. Is it
Well,
in
I can tell you right now. You mark your calendar because I
Yeah,
think it's
yeah. Let everybody know.
we'll be on with you. Oh gosh, I just had it pulled up. It's I think the third week in June. And then next Friday, I'm sorry, this is
Yeah, it
actually
is June
is it
20th. Yeah.
June
Mhm.
20th. There we go.
Yeah.
And Lisa, who's working in the background with us today, she'll be our next webinar guest, and that'll be the first week in June. Lisa, you want to tell, since you're here, you can tell everyone what your topic's going to be, maybe? You can, since,
Yes, I'm going to be talking a little bit about summer safety because we're here and there's just so many of birds that are flying off out there, and we need to remind everybody and make sure they keep their companions safe. And then we're going to just do a little question and answer, I think, pretty much on anything.
there we go. All
The
right.
great this time around.
There you
Yes,
go.
and I want to thank Lisa too for being and helping and
Yes.
with the webinar today. Very nice. Thank you.
Yes. Thank you, Lisa, for jumping in there. Appreciate it.
Anytime.
All
Thank
right,
you.
guys. On that note, I'm going to wish everyone a happy, great weekend ahead. And thanks again, Dr. Tully. It's always a pleasure.
Yes, and everybody have a great Memorial Day. And the next time we meet, it'll be midsummer. It'll be the longest day of the year, and looking forward to it.
There we go. All right,
All
guys.
right, thank you, Laura.
All right.
Bye bye. Thank you.
All right. Bye, guys. And the